Dr. David Hefferon, hello. Thank you very much for coming to the conference. Can you tell us a little bit more about your background?
I'm a holistic dentist, so I do mercury removal, TMJ, balancing, looking at orthodontics, cosmetic dentistry as well, but more looking at how the teeth affect the rest of the body. And that's what's taken me into actually doing the Laguna method as well, and using it to help the patients recover a lot quicker and a lot more.
And from what you said, I understood that you've been practicing the method for quite a long time.
Yeah. Well, I qualified as a normal dentist and worked for 4 years, then I moved to Germany for 10 years. And in that process I started working in an integrated way, and through working with Germany then I moved to London and then to Sydney and now back to Ireland. So taking in a lot of things, and then on that process I found the Guna method. Started off finding the heel, now I moved on to Guna and I find it exceptionally good at giving you that better result with the patients.
What makes a difference, or what makes Guna products and Guna method different? Why you choose Guna? Because there's plenty other alternative or complementary methods or complementary products. What made you choose Guna?
Because they work is the simple answer. You get the results with them, and it's more the method. It's not just the product. So there's loads of products out there, and they work in conjunction with so many other products. It's the lack of side effects and the fact that you can get people better quicker. They work more efficiently.
To me, from what you just said, to me the key word was method.
Yes.
So that, maybe I'm kind of running ahead too much, but does that mean to you that education in this case is more important than product? Than information on products, the education on the method?
I think the education on the method is essential, because it's not just a product, because people are trying to sell you. There's no shortage of people coming to the dental practice saying, "Oh, have you tried this? Or you tried this?" And everything works immediately the next day, and there's a lot of promises, but it's the method of knowing how to use it. And it's actually very simple as well once you get it. Well, when you listen to Alexandro, it's very simple. Trying to apply it might be different, but it's that level of education that people understand. It's actually the regulating of the natural body systems that make them different than just taking a product for one particular symptom, because you're doing it the root cause as opposed to the actual symptomology of anything.
So you do look at your patients as a whole, as a psycho-neuroendocrine immunology beings, and that helps you.
I would look at that and say, what is the patient presenting with symptoms? For example, fibromyalgia. Alexander was talking about that just from a Guna perspective. To me, that's a jaw joint issue causing all those problems. So you can balance the jaw joint using a bite guard or something like that, or it's mercury toxicity, or whatever the cause is. But that has been affecting the body over a long period of time. Most of the people you're seeing are chronic illnesses, so if you don't fix the regulatory mechanisms at the same time, they can make them feel a bit better, but never actually get them 100%.
Would that mean that physiological regulating medicine is sort of a universal approach to, it doesn't matter, is it dentistry, is that general practice, is that endocrinology, it's kind of universal approach to human health rather than human illness?
Yes, I'd agree with that, because as a dentist I work with osteopaths and chiropractors and nutritionists, whatever the patient needs, to try and provide as an integrated approach as possible. But one of the things that encompasses all of that would be the Guna method and the remedies that they use. Mercury sort of is a universal killer of everything. The jaw joint can affect your ankles, your sports performance, and kill everything, and Guna is one of the few things that can put it all together. And you only see a patient for a certain amount of time, and you send them to the chiropractor, they're seeing that, but it's 30 minutes or an hour of treatment. The Guna is going all in the background. So when you send them out of your office, the treatment's still working and you're healing them, so they're coming back that bit better before you see them again.
That's very, very interesting. Did you enjoy the conference?
Immensely. Every time I hear Alexander, there's always something new, and it's just his enthusiasm. Explains it very easily. For what is a complicated principle, is actually explained very easy, so you understand it, and then it's something that's easier. Then the use of the mechanisms are very easy as well. The remedies are simple to use, and they give you the desired result.
as a medical professional and as someone who at some point of their career kind of got into Guna, what do you think we as distributors of Guna method and Guna products could do better to make it available to a wider medical community in Ireland?
I think it's educating doctors about what it is. It's just not a product, it's how they work. And when you listen to Alexandra explaining the whole mechanisms behind it, how you can reverse things in a simple manner, then they start to understand, oh, that's what the product does, as opposed to this is a certain amount of magnesium in something, or it's a certain amount of calcium. It's not an orthomolecular remedy, it's a system. And if you understand that, then you get the Guna method.
So then everything goes back to method and education. And the last question, will you be coming back?
Most definitely.
Thank you very much. We'll see you.